Thank you everybody for your patience. Welcome. On behalf of the Education Subcommittee of the South Australian Maternal and Perinatal Mortality Committee, welcome to the 2021 Perinatal Forum. So the 24th forum this year, but it's the first to not be consecutive after the last interesting 18 months. This is the 14th that's titled the annual Dr. Ryan Pridmore Perinatal Forum. So to start, we would like to acknowledge the land that we meet on today is the traditional lands for the Kaurna people, and that we respect their spiritual relationship with their country. We also acknowledge the Kaurna people as the custodians of the Adelaide region, and that their cultural and heritage beliefs are still as important to the living Kaurna people today. It's certainly been a challenging 18 months, and as a committee we were really saddened to postpone the 2020 forum, but very intent on bringing you the forum this year. Very much similar to our own lives, we've made a number of modifications this year, which are pretty evident here tonight anyway, because this is the first time we've been able to hold this event as both a face-to-face but also as a virtual event. So it's been a big learning experience for all of us really in this setting. The modification to how we hold this forum has been quite a big one actually, and something we invite you all to give feedback on tonight. We've got a QR code which we're all pretty familiar with now, and that code we'll put up at the end of the talk today, but we can also email it through to anyone who does miss out. We're very keen to get feedback because it certainly always helps us for the next year's forum. One of the feedback suggestions from a couple of years ago was reiterated again in 2019, was for us to give you a little bit of information about Dr. Ryan Pridmore and who he was. So Dr. Ryan Roy Pridmore, he graduated with his MBBS from the University of Adelaide in 1964. He moved to the UK in 1967, training in ONG, and he obtained his membership of RCOG in 1971. Became a foundation fellow of the RCOG in 78 and obtained his diploma of diagnostic ultrasound at that year as well. Came back to Adelaide in 74, commencing work at the QEH as an obstetrician, and he practiced there for almost 40 years. Among his many feats, he was chair of the Perinatal Subcommittee of the State Maternity, Perinatal and Infant Mortality Committee, and so he was involved in a number of really significant things for obstetric care in South Australia. He importantly led the introduction of antenatal shared care. He helped develop the template for the shared care program, which of course is now a statewide service. And he was a very important advocate for the team approach in obstetric care. So really advocating for that communication and care approach between obstetricians and midwives, and led to the introduction of the handheld record, which of course we all know and love today. And the other thing, I guess finally, he was the inaugural chair of the organising committee, what was known as the Forum, prior to being named in his memory in 2007. Okay. So, I know I bring this one up every year, I have to remind myself of the SA Health website. We'd like to say a big thank you to Anthony Calicchio, who's assisting us tonight with filming, and has been fantastic in setting all of this up for us. We will be recording this tonight, and the edited version's available on the SA Health website, so if you do happen to be browsing there, going into clinical resources, you can track it down through the A to Z forum, and then certainly you can look at the previous years, which I've been hosting for a few years now, and have been pregnant every second year, but not anymore. Now more than ever, access to virtual forums and conferences is paramount. The previous forums are available, so particularly if you're wanting to refresh things, there's some fantastic speakers we've had in the past with a lot of very relevant topics to today. I keep going back to that one. Our committee has undergone a number of changes since our 23rd forum. We've had a change in our chair. We welcomed Dr. Tracy Bradbury into the role of chair of the committee. We've also had a change in our midwifery leave, with Sam Powell leaving and Kylie Bryant stepping in. And Kylie is somewhere up the back, way at the top of the top there. Our other members still include Dr. Morgan Vitani, Dr. Vanish Bhatia, Dr. Ken Wangahu, Kim Parker-Gray, who was sitting somewhere, there she is, Anita Ola, who's also somewhere around the room over here, Kirsty Roberts over here, and myself. And one of our most important members, who's otherwise enjoying his retirement, is Dr. Brian Wheatley, who's continued to tirelessly support our team despite not always being in the same state. And I think he might be sort of linking in on Teams tonight, because I think he might still be in Victoria. Okay, so one of the really important roles of this forum is to update or bring your attention the latest recommendations that appear in the most recent annual report. And so we've been able to access the 2018 recommendations very recently, which are quite detailed. And there are a few little pertinent points here. Cardiovascular disease, so it's one of the leading causes of maternal death in Australia. And the 2018 review of maternal deaths highlighted the importance of early identification and judicious antenatal and postnatal management of women who are experiencing cardiac conditions. Clinicians caring for affected women should consider the need for birth to occur in an intensive care facility or setting, assessing the woman carefully prior to considering early discharge, and facilitating regular postnatal review by a physician. So that's the first recommendation. The second, high-quality morphology ultrasound is an essential component of antenatal care and allows healthcare providers and women access to critical information to help inform decision-making. The review of the 2018 perinatal deaths demonstrated that in a very small number of cases, ultrasonography was not high quality, contributing to the delays in diagnosis and subsequent suboptimal outcomes for women and their families. The subcommittee would like to highlight the role that appropriately timed morphology ultrasound, along with thorough assessment of the placenta and the fetus for structural anomalies, contribute to improved perinatal outcomes. And then finally, women who live in rural and remote areas face additional barriers to care in comparison to women living in metropolitan areas. The 2018 perinatal mortality review highlighted that a small proportion of women in regional areas were deterred from accessing antenatal care due to increased out-of-pocket expenses for care. Women in rural and remote areas will benefit from contemporary approaches to maternity care, including increased access to fully bulk billed models of care such as caseload midwifery care, as well as telemedicine. And I guess we've been able to develop that over the last 18 months really, and hopefully we'll continue to do so. So we get to move on now to this year's forum. We're very thankful to our invited experts who have very kindly volunteered their time to help us out with this education night. At the end of the 5 presentations tonight, there'll be an opportunity for you to ask questions, and we would value as many as you would like. And so we'll do a combination of both people in the room who can ask the questions, but also anyone on Teams tonight. If you'd like to type in the questions, we're going to be monitoring them for the duration of the talks, and one of us will ask those questions for you later. So the placenta, where would we all be without it? We've got this great group of speakers, all experts in their fields, and we look forward to hearing them impart their knowledge on us tonight. So without further ado.